for sure.
Okay. All right, welcome back. You know, many people unfortunately mistakenly think they can get to the hospital faster than an ambulance can. And joining us now to talk about this dichotomy, Susan Moat. She's Vice President of Patient Care Services and the Chief Nursing Officer for the Heart Hospital Baylor Plano. Susan, thanks for coming in.
Well, thank you for having me.
So this is a huge issue and a large misconception, right, that you find all the time.
Absolutely, and you know, I think people are somewhat hesitant to contact. You know, they don't want to call the attention. They're not really sure what's going on. So it's really important to get the message out that says that our emergency medical contact people want to come. They want to assess. If they need to, you know, tell you that no otherwise that you can be followed up with a doctor, they certainly will. But it's so important. The medical treatment and equipment is right there and readily available, and also allows them to transmit information readily to the Heart Hospital.
But you know, if you're not sure you're having a heart attack, and I know for women, the symptoms can be very, very different than for men. So you don't want to overreact. You don't want to use those resources unless it's absolutely necessary.
Or so call the attention of your neighborhood to your home. Maybe you're not sure.
I would be reluctant to call for that reason.
Well, you know, I have told so many people in the emergency department, we are so glad you called 911.
Wow.
Even if it isn't a heart attack.
Okay.
Because we want people to feel comfortable calling 911. We want to be overcalled. If we're needed, or if somebody feels like they need to come in, we want to be there for them. So really, there's a collaboration really now between the hospitals and emergency medical services to really ensure that we're reaching out, doing shows like this, spreading the message, but that we're also making a difference in survival.
With the obvious overcrowding of emergency rooms, because so many people have begun using it for everything instead of a clinic visit because they can get in faster. Isn't this a way that you will be seen quicker as well? If you come in an ambulance, it's different from walking in the door. You don't face a crowd. There's a couple of people pushing that gurney and you're right there.
Well, it's such an advantage now, the technology that we have that's available for us to use in treatment and care of patients. So it is a benefit because we can transmit information. We can transmit the electrical signals that are coming from your heart that let us know if you're having a heart attack or have suspicion. We can transmit that right to the emergency department and have a physician readily available to look at
So half the diagnosis is already done before you're ever there.
Absolutely. So it really does streamline the care that you receive.
And is the 911 service, how is it routed? By that I mean, if there is the suspicion that there's a cardiovascular event, is it very likely that a different type of EMS unit will be sent versus a broken leg?
Oftentimes, yes. I mean, they, you know, our EMS, all of our first responders are very, very well equipped and extremely well trained. So yes, they do respond, and they're very sensitive as to what they have.
Well, in my neighborhood, if it's a heart attack, there's an ambulance and there's a fire truck with it. So there's two vehicles there automatically, and you always know when it's a heart attack because they don't come with the sirens on.
And then there's dangers of involved with taking yourself to the hospital or having someone drive you.
Well, absolutely. If you are having a heart attack, you are very likely to have what's called an arrhythmia, or something that may allow your heart not to pump or beat right. So you could pass out at the wheel, and oftentimes that does happen. So you generally don't want to have that happen while you're driving, or even if a loved one is driving you. You don't want them to focus on you. They need to drive. So that's why we say it's so important not to even have a loved one drive you. Just call 911.
Leave it to the professionals. One other concern, Susan, I have to bring this up, is the expense. Are there some issues sometimes you find that people say, I really don't want to share that burden or have to pay for the 911 treatment if there's a chance that I really don't need it after all?
Well, you know, I think the overarching thing is we want people to survive, you know, and I think it's really important that if you feel that something is going on, you have to take your health very, very seriously. And, you know, expense aside, we have to take care of ourselves, and we have to take care of our loved ones.
And most insurers will cover some or a portion?
Absolutely, absolutely. Any emergency treatment that is warranted, absolutely.
Okay, so don't hesitate. Call 911.
Yes.
That's the message.
I just have to say kudos to all those folks who answer those 911 calls. I've had occasion to call, and they can be so calming and so nice, and just thanks to everybody who's
Yeah.
doing that
Yeah.
job.
Yeah.
you
Well,
know?
we're honored every day.
Yeah.
We think we work with some of the most dynamic first responders. We're very fortunate, the Heart Hospital Baylor Plano, and now we have a new Heart Hospital, Baylor Denton, in the Denton County, so we can extend our reach and provide world-class cardiology
That's great
care.
news.
So
Okay,
we're
Susan
excited.
Mose, thank you so much for
Thank you.
coming in. Appreciate that information. And coming up next on the Texas Daily, what exactly do your shoes track inside, and is that a health issue? Okay, we're going to talk about where your shoes go. Should you take them off before you come home? Coming up next, stay here.